101.3 Abuja, the station that plays every song you know. Well, beautiful thing, my guest is here, and it's 10:30, Wednesday, the 24th of April, 2024. And yes, like I had talked about before, it's World Immunization Week 2024, one of humanity's greatest achievements in the push to save lives is the availability of vaccines. And I'm super excited to have the Chief of Health, UNICEF, Eduardo Celades, seated with me this morning. Apologies for the traffic. You were just headed from the airport this morning here. But thankfully, you made it, and, we can have this interview.
Thank you very much, Itohan, for inviting me here today. This is my favorite radio station.
Oh, you see, well, he says he listens to us every single day when he's driving to work and driving back home. And he was super excited to walk into, this is Classic Affair. Yes, you're here finally. You're welcome once again.
Thank you.
All right, so let's begin. Now, this year's World Immunization Week celebrates 50 years of the expanded program on immunization. Tell us more about that.
You're right. So 50 years ago, what we call EPI, the Expanded Program of Immunization, was launched in the world, in Africa, in Asia, everywhere. At the time, it was a very small program, only 6 antigens, only 6 vaccines. Now it's 50 years later. What we have achieved is incredible, right? We estimate that more than 150 million lives have been saved. The reduction of infant mortality more than 40%. So huge achievements in the last 50 years.
That's right.
However, this is like a little bit like a marriage, right? After 50 years of being married. So what we are seeing is like people start to be a little bit tired. Vaccines, you hear about this vaccine hesitance, the rumors, the misinformation.
That's right, misconceptions, myths and rest, yes.
Right. So, after 50 years, people are thinking, oh, we are still here, right? But I will look from the other way around, right? The successes were huge. We eradicated the smallpox from the world.
Right. Oh, beautiful.
Polio is not in Nigeria anymore. We still have few cases in Afghanistan and Pakistan, but this almost ended, right? And I would like for us to fall in love again with vaccines, right? That's after 50 years of marriage, how we can have another honeymoon, how we can really think, okay, we have another 50 years ahead, let's say.
Okay.
And the future of vaccines, it's bright. I mean, in Nigeria, we just introduced HPV vaccine for young girls to prevent cancer.
That's right.
So now we have vaccines that they can prevent cancer, right? Malaria vaccine that it will be coming as well later this year to Nigeria.
Oh, excited about that one.
Right, and maybe starting with few states, but in 1 year or two to be in the whole country. So that's exciting, right? Maybe we don't have yet a vaccine for HIV, but maybe it will happen in the next few years. So I would like to the slogan for this year is humanly possible, right?
Humanly possible, that's right.
So I think it's a very exciting moment. 50 years have gone, but if we look to the future, I think we're in a good moment.
All right, that's very interesting. Okay, so talking about misconceptions, myths, and still trying to convince people about vaccines 50 years later. Now, what do you think is the major reason for that? Do you think because they believe that since the vaccines are not made in Nigeria, there's this idea that probably it may cost one or two things that they are not telling us the truth about? Is that why people are really not accepting the vaccines?
I think there are a few reasons. Like it's not a single source of truth on this one. One was COVID-19. Suddenly, vaccines were produced very quickly. So people were wondering why is that? What is this COVID? It was difficult for a normal person to really process all the information that was received. Other issue I think is like 50 years ago when this started, it was only 6 vaccines. I mean, you, myself, all our parents vaccinated us, right? It was very straightforward.
Yes.
You have a child, you vaccinate them. Now we have more than 13 recommended. In some countries, like in Nigeria, we can go up to 17 vaccines. So people start to wonder, right? Now we have new ages, like the HPV going for adolescent girls. We have vaccines for so many things. So people start, it's not so easy like before, right? And as well, maybe some fatigue. People now, they don't see the effects of the vaccine. So vaccines work. So just think in an outbreak. For example, a few months ago, we had an outbreak of meningitis in northern Nigeria. You didn't hear about that. And why is that? Because of the vaccines were working. Okay. So as soon as the outbreak started, they were doing quick rounds of vaccination and the outbreak can be controlled.
Okay.
So sometimes the good news, they don't make the news, let's say.
Oh, I see that. I see where you're coming from. Now, how does UNICEF collaborate with other organizations and also the government, in particular the Nigerian government, to promote immunization, especially in primary healthcare centers?
Right. This is actually our focus. So we have like two main priorities. One is one challenge that we have is like the big number of children in Nigeria that they don't have any single vaccine.
I see.
We call them a zero dose children.
Mm.
Like they were unable to get any vaccine. And Nigeria is the country in the world with the largest number of zero dose children, more than 2 million. So our priority is to support the government to reach them, right? With outreach clinics, ensuring that the primary healthcare is functioning, with cold chain, with staff, that there is a community health worker. So that's one of our main priorities, and we work very closely with supporting NPHCDA and the Federal Ministry of Health. Our second priority is to work with the communities, and you talk about rumors, misinformation. So it's all this work at community level, right?
Okay.
With the traditional leaders, with the influencers, with the women leaders at community level, religious leaders, to really gather, like, it's like our message is like, if you love, if you care, if you respect your children, get vaccinated.
Get vaccinated. All right, we're still speaking to the Chief of Health, UNICEF, Eduardo Celades, and he is here with us live in the studio. Now, also, the issue of insecurity, has that also hindered immunization reach? And how are you planning to, infuse more children to getting vaccinated despite the issues of banditry and general insecurity, especially in northern Nigeria?
Right. If you remember when polio, the last cases of polio, like wild polio that we had in Nigeria, were in the northeast, right, in very difficult to access and due to conflict and violence. Now, what we are seeing is that the lowest immunization coverage, so the lowest number of children vaccinated, are actually northwest of Nigeria, right, in Sokoto, Kebbi, Zamfara, that as well face a lot of violence and insecurity issues, right?
Yes.
So we are trying to work on that, and what we are trying to do is like to ensure that the communities are involved in the vaccination process. I will give you an example.
All right.
Sometimes the vaccination teams, when they go to a remote community in Zamfara, they're coming from outside, right? And then they face rejection, they cannot really plan, the children don't go, they face insecurity. So what we are trying to ensure, supporting MPHCDA, is that the teams are selected by their own communities,
Okay.
right? So they have the
Yes.
acceptance, right?
Okay.
So they will not face insecurity, and even for the vaccine hesitance, it's like someone from my community is telling me, look, I have here the vaccines, right? And we think that this strategy is working, actually.
It is working. All right. We'd love to hear that. Now, also, and you might be getting questions about production of vaccines within the country. What's your response to that? Like, instead of importing these things into the country, which is costing the government a lot of money, and
Right.
a lot of organizations and also donor agencies as well. What's the plan?
I love that question, and you are fully right. Look, we are importing at this moment to the country more than 400 million doses of vaccines. It's massive. We receive like almost every 2 days one vaccines by plane. So more than 200 shipments from all of them from out of Nigeria, and most of them from out of Africa.
Sure.
Right. So I think the government, starting by the president, but as well by the coordinated Minister of Health, they said it very clearly. We want to produce vaccines in Africa. We want to produce vaccines in Nigeria.
Good.
So this is where I think we need to move, right? As well, I think that will contribute, as you said earlier, maybe even to reduce vaccine hesitance. If this is something produced in
Nigeria, made in Nigeria,
by Nigerians for the Nigerian population.
Oh yes.
Yeah. So hopefully we can reduce the cost. We can increase the intake, and we can even support other countries, our neighbors, right? Togo, Benin, Ghana. So we as UNICEF, we are committed to that. I just came from Lagos to have a meeting with NAFDAC and others to see how we can really support that agenda. I think not only for vaccines, but as well for syringes, for medicines. This is an amazing country, 200 million people here, right? A huge market, bright minds. So I am really proud to be here supporting these efforts, and really I hope to see that happening in the next couple of years.
Okay, that's good. All right, you can be part of the conversation. You can send messages via WhatsApp 0909 697 5943, or you can give us a call on 0817 288 7943 for your contribution. Eduardo Celades is seated here. He's the Chief of Health, UNICEF, and we're looking at on celebrating starting from today the World Immunization Week 2024. Now, do you also get resistance with people who say, why the interest in Nigeria? Why so much interest in the country? Why is there so much focus in the Northeast? Is it that the problems outside the country be solved, and that's why you focus on Africa. What's your response to that?
Very good question. So we always say that um, we cannot succeed in Africa if we don't succeed in Nigeria,
Okay.
right? The just think on the birth cohort in Nigeria. Nigeria is producing. We have like 8 million pregnancies every year, right? So 8 million new babies every year.
8 million
Million
every year.
every year.
Ooh.
Still 50% of them are births that are happening at home. So imagine that. But you have 8 million. So basically Nigeria is producing a country every year, right?
Mm.
If you think in 5 years, it's 40 million children, right?
Mm.
So if we really want to stop outbreaks and to stop public health emergencies to happen, we really need to ensure that these children are protected for their own lives, but as well for the others. Let me just give you an example. Now there is this polio variant circulating, right? Especially in 5 states in the north, right? Katsina, Sokoto, Zamfara, Kebbi, and a few states. But these viruses are spreading out to other countries in West Africa, right? So the only way that we can succeed, right, is if we succeed in Nigeria. The issue with outbreaks and diseases is like until you don't stop them, they will continue coming back again and again. Just think in cholera, for example,
Yes.
or in measles, right? But once you get a good herd immunity, like almost everybody around you is immunized, then the disease goes.
And it's gone.
And it's gone, right? And then you can forget and you can do something else. That you can
True.
invest in something
else. Yeah.
Right. So that's why Nigeria is so important.
Okay, that's good. All right, so Eduardo, I know that you have to go back to work, but just take us through the immunization for newborns. I always love to ask that because I have special interest in children, just like my health program. So take us through the vaccination for newborns. Once a child is born, how important is it for that child to be immunized? And I know that for the very first 1 year of life, there has to be immunizations that have to go into the child.
Right. So just at the moment of when the baby is born, we have like 3 vaccines. We can give to the baby. Like this is the BCG for tuberculosis, it's the OPV for polio, and it's the one for hepatitis. Right. So this is the moment that the newborn is born.
That's right.
And that will give him or her protection, right, during most of the life. Then at 4 weeks, again, we have another set of vaccines.
Okay.
And so basically, in the first year of life, a newborn needs to come about to get 6 times to get vaccines, right? Five to 6 times.
Okay.
Right? And that's very important because, as you said, is to get the child fully immunized, fully protected. And me, we are fully protected. We got our vaccines, right? Our kids got the vaccines. But it's difficult, right, to come back 5 times to a public health facility if maybe you are poor, you are far away from the health facility. Maybe you go to the health facility and there is not a nurse or a doctor or a technician to give you the
available
vaccine.
Yes.
Maybe the health facility doesn't have light or power, right?
To store the vaccines.
Or water. So that's why for us it's so important to invest in primary healthcare, right? To ensure that the primary healthcare facility, the one that is closest to you, right? They have the vaccines that they need. They have the nurses, midwives, doctors, medicines, or water to be able to protect the children. If we protect the children, what are the main 3 killers for children under 5 in Nigeria? Are 3: pneumonia, diarrhea, and malaria, right? For pneumonia, we have now a vaccine, the PCV vaccine. It's for pneumococcus. It works. For diarrhea, we have rotavirus.
That's
Remember?
right.
A couple of years ago was introduced here in Nigeria.
Yes.
For malaria, it's not only the vaccine that we'll have later this year and next year, but it's as well the mosquito nets. It's more an integrated approach that we need, right? But the issue is like, if we put all these pieces together, and then we have community health workers, a good referral mechanism, a good hospital, good staff, we can really reduce under 5 mortality. Still, 1 out of 10 children in Nigeria is going to die before the age of 5.
It's very sad.
So yeah, that's a huge number. It's very sad, but we know how to
avoid it.
Avoid it.
That's good.
So I like to be optimistic. I know that things are progressing, things are moving. We have a great leadership, and things take time as well. But I really think we're in the good track. I hope like in 2 years you invite me, I come here back and say, look, things have improved quite a lot.
Things have changed. All right, now coming since you got into Nigeria, taking over, at UNICEF, would you say that there's been significant progress? And in the next couple of years, what does UNICEF hope to achieve?
Thank you. So look, I have been here in Nigeria 2 years and a half.
Yes.
I visited already like 17, no, 19 states. So I'm trying to really find how things are moving, right?
Okay.
And yes, I see progress. COVID-19 it was very harmful, right? Not because Nigeria didn't progress, but the pace slowed down, right? It was difficult to really move the agenda to reach those children in remote communities when as well you need to respond to the biggest and largest pandemic in one generation. Right? So it was difficult to do everything at the same time. Now we have a very, very strong leadership with Mohamed Ali Pateh, that it's a very well-known figure in the world for public health, right? Nigerian doctors and nurses are the best ones in the world, right? We are still facing the issue of brain,
Yeah, leaving the country.
Uh-huh.
Call you Jackba. Yes, yes.
So, but still, here we have an amazing professionals. I mean, we have the resources, we have the political willingness. Now we have partners like us that we are supporting that agenda. So that's why I would like to be optimistic moving forward. I don't know how. I mean, how long is our tenure here in normally in countries is like about 4 years.
Okay.
So, but I hope like when I'm leaving to really see, okay, wow, all of that has been done.
Has been done. That's right. All right. A question just came via WhatsApp. It says, how does UNICEF ensure equitable access to vaccines for vulnerable population, including those in conflict-affected areas or remote regions?
Look, I will give you. Thank you very much for that question. It's great to see that the audience is engaged.
Yes.
So greetings to all of you guys. I will give you two examples. I just came from Bayelsa last week.
Okay.
And Bayelsa is a riverine state, right?
Yes,
With a lot
it
of
is.
rivers, the ocean, etc. And one challenge that they were facing is like how to reach to some of these communities that there is not even a road or a road in good conditions. So what we did, working with our partners, is to purchase like ambulance boats. So
That's
now
nice.
so now we can have like the mobile brigades can go into the boat. It's a boat ambulance with a stretcher, with everything, with a siren, so they can go to these remote communities, targeting the more than 20,000 children that they don't have any vaccine in Bayelsa in these communities.
Oh.
Of course, in other areas, for example, IDPs, displaced people. So we are working in Benue, in Maiduguri, in other places as well, trying to ensure that when a child arrives to a displacement camp or is new to a new community, to ensure that this baby is vaccinated. Especially against measles, because measles can be like really a real killer.
That's at 9 months.
Yeah.
Yeah, that's right.
I can see that you know very well our skill.
Thank you. Yes, I like to take that one. All right, so we're wrapping up now. Thank you so much, Eduardo Celades, for stopping by, despite the hitch that you went through on our way to the office. We really do appreciate you. Your final words as we wrap up.
Thank you very much for the invite. This is the World Immunization Week. I think Nigeria is progressing quite a lot. I like to be optimistic, and I think if we look to the future, we are facing a bright future for the health of children. So I'm looking forward to see that.
Thank you so much. He's the Chief of Health, UNICEF, and we do really appreciate UNICEF for always stopping by to give us information as you can send everything going on in the world of public health. We appreciate you for stopping by. It's Classic FM 94.3 Abuja, the station that plays every song. Stick with us. We'll be back. Good morning.